Intermittent self-catheterization (ISC) is a safe, effective, and cost-efficient method of bladder training. It helps manage urinary retention caused by bladder or urethral dysfunction and improves symptoms of urinary incontinence. ISC also reduces the physical and psychological burden associated with long-term indwelling catheter use, enhances the quality of life, and lowers the risk of complications such as infections. Hence, learning how to perform ISC correctly is essential. This video will guide you through the process in detail. When to start catheterization. 1. With a physician's order. 2. When you are not receiving intravenous nutrition or fluids. 3. When your daily fluid intake is less than 2,000 milliliters. Supplies you'll need for catheterization. Intermittent catheter, povidone iodine, water-based antiseptic, lubricating jelly, single sterile glove, urine collection container, urinal, boiled, cooled water. Required mirror for female patients. For cleansing. Irrigation bottle, filled with warm water. Sterile cotton-tipped applicators. Bedpan. Important note: before using a new catheter, fill the outer storage tube with povidone iodine up to the marked line. Let the catheter soak for 2 to 3 minutes before use. Preparation before inserting the catheter. 1. Allow the patient to try to urinate naturally first. Record the amount voided in the table. 2. Clean the perineal area. If able, perform self-cleaning. If assistance is needed, a caregiver should help with perineal cleansing while in bed. 3. Wash hands with soap and water or use an alcohol-based sanitizer. 4. Position the patient in a seated or supine position with knees bent. 5. Place the urinal at the foot of the bed. 6. Remove the catheter cap and hang it within reach. 7. Open the lubricant tube and set it aside. Lubricating the catheter. Put a sterile glove on your right hand, avoiding contact with the inside of the packaging. Keep your gloved hand elevated to maintain sterility. Lay the glove's paper wrapper flat next to the urinal. Caution: this is a sterile area. Do not touch the inner surface. With your left hand, remove the catheter from the tube and place it on the sterile wrapper. Caution: avoid touching any part of the catheter outside the cap. Squeeze a small amount of lubricant onto the catheter tip. Caution: do not let the lubricant tube touch the catheter. Using your gloved right hand, evenly coat the entire catheter. Hold the lubricated catheter with your right hand and remove the cap completely with your left. How to perform catheterization for females. With your left hand, spread the labia to expose the urethral opening and hold the position. With your gloved right hand, gently insert the catheter into the urethra until urine begins to flow. Once urine flows, pinch the catheter with your left hand, then use your right hand to remove the cap. Attach the catheter to the urinal and release your grip, keeping the catheter stable. When the urine stops flowing, gently press the lower abdomen to help empty any remaining urine. Thoroughly record the time of catheterization, fluid intake, volume natural urination, volume of catheterized urine, and urine color in your bladder training log. Cleaning the catheter. After each use, rinse the catheter thoroughly with boiled, cold water and shake dry. Return the catheter to its outer tube for soaking in povidone iodine. Storing the catheter. 1. Change the povidone iodine solution in the outer tube daily at the same time. How to replace the povidone iodine solution. Discard the used solution into the toilet after use, then refill the tube to the indicated line. Caution, do not rinse the tube. 2. Do not disinfect the catheter by boiling, as it can damage the material. 3. Replace the catheter every 4 weeks. Important reminders. 1. Frequency and timing of catheterization should follow your physician's instructions. 2. During training, aim to drink 250 milliliters of water every 2 hours from 7 a.m. to 9 p.m., including fluids from meals and fruit. 3. Avoid drinking water after 9 p.m. 4. Perform one final catheterization around 10 p.m. or before bed to reduce the need for nighttime voiding. 5. Drinking plum or cranberry juice may help acidify your urine and reduce the risk of urinary tract infections, UTIs. 6. If you notice cloudy urine, sediment, blood in the urine, fever, back pain, or abdominal discomfort during catheterization, these may be signs of a UTI. Please seek medical attention immediately. Final note of reminder. Intermittent self-catheterization should be continued under the guidance of your healthcare provider. Patients must return for regular follow-up appointments and bring their daily bladder training logs for review and adjustment of catheterization frequency.